Hi, and welcome to 21st Century Healthcare Consultants' official podcast, Home Care Today. I'm your host, Kate Rose, and I'm enjoying an opportunity to visit with somebody that I know that you all are going to really appreciate hearing from. Denise Bellville is our guest today. She is the Executive Director of the Home Care Association of Florida, or better known as HCAF. Denise, thank you so much for being here.
Oh, thanks so much for inviting me.
I know that we chit-chatted just a second ago. We're actually broadcasting this today, or taping this today in December, coming up on Christmas, and I appreciated the fact that Denise is in the Christmas spirit. She's got on her beautiful Christmas cardigan, and in Florida, sometimes that can be hard to pull off when it's 95 degrees outside, so kudos to anybody who's got the spirit and they're willing to let it loose. So thanks for doing that for me. I haven't gotten there yet. So Denise, let's talk a little bit about what HCAF is. If you could give our viewers an opportunity to hear from you what the organization is, what you do, and basically a little bit of a background on your operations.
Okay. Well, as you introduced, I am Denise Bellville, and I'm the Executive Director for the Home Care Association of Florida. We are an association really designed for Florida providers, for us to be able to be their advocate, to provide additional education that they perhaps are not able to get in their own agencies, and then also to be able to provide for them some resources. And sometimes that resources is regulatory, sometimes it is the things that are coming down from CMS. Sometimes it's just somebody help me with this rule, or even to support them as they might be going through a survey. So we sort of incorporate all of that into our business line. We support all providers. Unfortunately, all providers are not members. It is a member-driven association. We have both members and associate members. And we have a total of a little over 6,000 providers, licensed providers in the state of Florida. And unfortunately, the Home Care Association only has about 680 of those.
Okay. If someone was interested, and we can talk about this later on in the broadcast as well, but if somebody is interested in becoming a member, what's the process for that?
So really, if they reach out to the Home Care Association, we can walk them through what that membership looks like. It is a little different depending on your provider type. So if you're certified, it's based on your revenue. If you're private duty, it is a flat rate, is not associated with revenue, not associated with revenue.
What would you say would be the top one or two benefits that someone would gain through their membership in HCAF?
I have to say the number one is advocacy. I think what we are able to do through both federal and state efforts changes the landscape that a home care agency operates under. When rules are changed because of our efforts, and now an agency doesn't have to do XYZ, whatever that happens to be for that legislative session, we make a difference. We make a difference for that agency. And I think the second thing is, anytime there is a change in the industry, whether that is a national change or a state change, the association has the ability to provide that education to all providers who are servicing the clients in their homes.
You talk about changes in trends and regulatory changes and so on and so forth. What does HCAF have to say about those trends and what's shaping the industry in the state of Florida today? What's your take on that?
I think what's shaping us right now is the workforce, particularly as it relates to nurses for certified and private duty, is we have a terrible nursing shortage. Maybe terrible is not the right word to use, but it is almost suffocating.
It's critical.
We are we are going to be in this situation for the next 10 years. And although there is, and the governor has set aside some monies within the budget for both pipeline and line that are meant to help with some of the RN, LPN nursing shortage, but they are associated with hospital collaboration, not with home care. So we are still in that same situation of home care not having adequate, especially nursing shortages, which I have to tell you means that we also have inadequate services to be able to offer to those folks who live at home,
Right.
those most vulnerable, is we don't have the ability to care for those. There's a 76% rejection rate in the nation related to home care referrals because of not having nurses to admit those patients. That is a sad state of affairs.
It sure is. It sure is. How is HCAF stepping into that space and helping your members?
So, I'm so glad you asked because honestly, I was meeting with CEOs of hospice organization. Hospice also provides home care. And I was talking to their board just at the beginning of November and imploring really those CEOs, what can you do to help us directly into home care? And there were a couple of CEOs on the East Coast who said, we are actually providing salaries to the local universities that will add a clinician educator to now add on another 15 students. And those students then are going to be our next employees when they're done with when they've completed. We are partnering throughout the state with those types of entities to make that happen. Now, I do have to tell you, we also are partnering with some of the plans in the state, meaning the managed care plans, Medicaid plans aspects. So not just that we have the nursing shortage, but we have a caregiver shortage. Those individuals who are willing to go into the home and provide those ancillary services or paraprofessional services. So we are partnering with plans to make sure that we are creating the right platform to do the education for those potential caregivers, and subsequently then adding personnel to our members that are members of the association.
What's your sense of what, and you may or may not be able to answer this, but what's your sense as to what's causing this shortage?
Income. It's all based on what the pay rates are. And, in this state, as long as the Medicaid or replacement plans, long-term care contracts continue to have the same rate of reimbursement that they do, then you'll continue to not be able to pay caregivers, that paraprofessional, more than what Amazon or, other competitors. And for nurses, it's always going to be, there is a better rate of pay somewhere other than home care, and home care continues to get cut every year. So I think as long as you're in the same situation of competitive pay, we're going to be in the same ballgame.
What's your take on what's being done to improve the situation? Can you identify anything in particular that might give folks some encouragement? Because if I'm looking to start an agency and I'm hearing that there's shortages in the staff that I require in order for my agency to be able to do its mission in the field successfully, and for me to be able to, actually grow as far as the financials are concerned. I mean, this is a serious issue. Can you find anything anywhere on the horizon that would give people some encouragement?
So two things. One is that we in the state of Florida are going to the legislation this coming session.
And by we, you mean HCAF.
HCAF, to with a bill to ask for the state of Florida to allow contract nurses to be able to perform admission discharges and reassessments. They currently cannot. So if we could bring in someone who wouldn't want to come to sunny Florida in the winter
Mm-hmm.
and have them be a contract nurse, now those agencies would have the ability to take more patients, would be able to grow their business because now they don't have that turnover rate.
Mm-hmm.
The other aspect related a little bit to that is that we have gone back. In fact, I had a CEO council meeting just a couple of weeks ago because in this lame duck period of the federal government, we had an initiative in place that we would like to see that there would be a pause in any further cuts in pay to the Medicare system for our certified providers, that we would pause it over the next 2 years. And that would allow us to hopefully get caught up on some of that
Right.
and or figure out a way, if it's $4.6 billion that they still feel like we have to claw back, what are some other measures throughout the entire US?
Mm-hmm.
I know we advanced VBP nationally, but what about extending RCD to every state in the US? What about adding even a bigger percentage to value-based purchasing components now? The rate
Mm-hmm.
right now, it's the highest is 5%. Let's go to 8 or 9. There were several measures that we put in place that we are, quite frankly, currently, as of today, waiting for CBO to give us a scoring as to where that might lay into getting those clawbacks back.
Okay.
If we can do that and pause any cuts in pay over the next 2 years and get contract nursing in the state of Florida, we
Mm-hmm.
might be able to really help providers in this state grow their businesses in the next 2 years, and maybe even
Mm-hmm.
get more staff because they'll be able to pay them without
Right.
without continued cuts.
Right. Right. Well, this this is a national issue, not just a state issue, correct?
National issue.
Is Florida, do you find that there's, what am I trying to say? There's a cooperative spirit across state lines and across state to national legislation, activities to try to solve this problem, not just at the grassroots level, but also to where it extends and helps more people?
So many of our national organizations, our national providers, also have businesses in Florida. So although we have a bigger voice, there's a couple of agencies or a couple of organizations that have 25 agencies here in Florida under that national name. So they are being helpful to us. They are, as I said, met with some of those CEOs just in the last few weeks to talk about what we might be able to do as an association,
Mm-hmm.
and then what we might be able to do to continue to come alongside those CEOs on their mission. We are all in the mission of taking
Right.
care of individuals and how we can do that. So
Right.
we're going to continue to partner with those national organizations to get that done.
It's a village concern. It's not just an individual concern. I can imagine.
And Florida is so highly regulated. Even my comrades that are executive directors in other states, you have to think there's 22 states that aren't even licensed.
Mm,
Those executive directors may have the same sort of issues, but in states like Florida, where we are so highly regulated, that makes it a bigger burden
right, right,
for certified providers.
right. So, how does HCAF actually help home care agencies stay compliant to make sure that everybody is doing what they need to do? How do you help them manage the financial challenges and access technology? And so, bringing it down to the individual agencies that you all work with. How do you help those individuals?
So I have to tell you, every month we are looking at everyone who is newly licensed, and we contact each one of them to see if they have any questions, have they come up with any regulatory issues, etc. We also look at anyone who has perhaps even had a visit from ACA and now they are trying to correct some of those mistakes that they may have made
Mm-hmm.
and again, to see what HCAF might be able to do to support them. We are continuing to support agencies at a home base. In other words, agencies that reach out to us who say we're due for licensure or a new license review, and are waiting for our survey, and we still have a few questions that we want to ask. I do have to tell you that we are ongoing, and as I said, we represent all providers. However, we uh, there's always a concern about folks providing within their license. So we do review often licensure to make sure folks are staying within their agreed upon license, the disciplines that they agree to.
I would imagine, this is not my personal industry, but I would imagine that compliance is critical. It has to be managed and maintained in such a way to keep agencies in the clear and not for them to stray left or right inadvertently, more than likely, in order to stay proficient, in order to do good care, and in order to run the business, on a plus side. So your involvement, both at the state level and obviously national as far as the concern is, but your involvement with the individual agencies to monitor their compliance has to be one of the greatest benefits that someone as a member would be able to receive from HCAF.
And we hear it all the time, that things like, we never knew that. Whatever the issue is, they'll call and say, do you know anything about it? And we let them, we answer the question, and that's the response. We never knew that. In fact, we just had a Private Duty 101 session in November for about 70 providers, and they were as young as less than a year in business, and those that were 10 years more in business, attending the same 101 class.
Wow.
And one of the gentlemen who'd been in business for 15 years said, we had so many things that we did not know, that even folks who'd been in a private duty business for that long just didn't know. So we're going to continue to do that sort of opportunity for folks to continue to educate themselves to stay compliant within their business model.
As resources go, it's clear to me, and I'm sure to our viewers as well, that your organization is absolutely critical. I would imagine that the membership is, and we're not going to get into numbers on this broadcast, but I would imagine that there's a saying in our family that the juice is worth the squeeze. So if there is something of value and it takes an investment of time, money, energy, resources, or whatever, that if that value is great enough, then it's going to be worth the squeeze to make sure that we become members of HCAF and any other organizations that would be helpful. If you had just a couple minutes left in our podcast today, if you had one piece of advice or wisdom that you wanted to share with the viewers about how HCAF can become part of their calling in the world to do good, to help others, and to be successful from a financial standpoint, what would you say?
Care about your business to care enough about us. And I say that because so much of what we do is for all 6,000. 660 are members. Then everyone else gets the benefit of those people who are paying in. It's so unfair to those who are willing to sacrifice those few dollars. Those few dollars in one phone call, when ACA might be sitting in your office and saying, we're here on, and they call us and we fix it. That saved you far more than a membership.
Absolutely.
And that's the resource. That's the opportunity we have to serve people every day, that we can make a difference for their businesses.
Well, the old saying that you don't know what you don't know And as you just stated, you had both brand new agencies and agencies that had been in business for years who at the end of that seminar or that conference said, we never knew. We didn't know. So thankfully, we have experts in the field across most industries, and you all certainly stand head and shoulders as somebody that people can turn to for information. And if they wanted to get in touch with you, what is the best way to do that?
Really, you can reach out to the Home Care Association .org
Okay.
website, and there's a contact form on there. They can always reach out to me personally, and all that information is located on the website.
Great. Denise, thank you so much for your time. I know that this is a busy time of year for everybody. We appreciate your expertise. We appreciate your just your willingness to share and to help other people in the industry. It's been a pleasure having you on the show today. And if anybody has any questions, we'll have the contact information available to you. This has been Kate Rose. We're at 21st Century Healthcare Consultants' official podcast, Home Care Today. And it's been a pleasure seeing you. Take good care, and we'll see you next time.